You hear all the time the phrase, "we're all in this together." And while the coronavirus pandemic does not discriminate against who it infects, old, young, male, or female, not all of us are as threatened by it as others. This global pandemic, like the global climate crisis, further exposes the widening gap of income inequality.
It always seems that the poorest people pay the highest price.
Age and pre-existing conditions are the biggest risk factors for a fatal case of coronavirus. But the third deadliest has nothing to do with health and everything to do with money.
COVID amplifies the injustices in our society. People who are less well off already, whether they have an existing medical problem, whether they are poor, these events, like COVID, amplify the harms of those conditions.
While many of us had the luxury of working from home, many lower-income workers can't, putting them at even greater risk. And it's not just a class divide. It's a racial one, too. On Monday, Louisiana Governor John Bel Edwards announcing that 70% of the deaths in his state are African Americans, despite being just 32% of the population. And in Michigan, a similar story. Blacks are 40% of the deaths, despite being just 14% of the state.
It's the communities that have more high blood pressure. They have more heart disease. Then if you just simply look at the places in the South where we've had enormous problems without expansion of the Medicaid program, where people have higher uninsurance rates. Again, all those communities map the same. So this is not rocket science.
The impact of this pandemic today on income inequality is a direct parallel to the impact that the growing climate crisis will continue to have in the months and years ahead.
The populations that were climate sensitive are many of the same ones that are going to be disproportionately impacted by this pandemic. When you do the map, it's exactly the same communities.
The people who are already vulnerable to air pollution, water and soil pollution, are the very people who are most vulnerable to the impacts of a changing climate. It's because it's a threat multiplier. It exacerbates the issues we are already challenged by today, which include poverty, vulnerability, lack of access to healthcare, overexposure to pollution. All of these things are exacerbated by a changing climate. It is all connected.
Because lower income groups are likelier to have chronic health problems and those conditions amplify COVID-19, a recent study shows this virus has twice the mortality rate among them. And cost of testing and treatment may be prohibitive too. 26% of Americans could not afford healthcare in 2019.